Well, we're looking ahead to that address by the President at 8 o'clock. We will bring it to you live. He is expected to move South Africa from the current lockdown level 3 to a lower lockdown level. And easing is expected because, of course, COVID-19 cases have come down quite substantially from around 20,000 per day to less than 6,000 or so. The size of gatherings will be very closely watched after the Constitutional Court rejected a bid by the IEC to delay those local government elections until next year. And of course, they will now be held soon on November the 1st. The President also likely to talk to vaccinations. Now, the Health Minister said this week, we got some figures there, that 26% of the adult population has received at least one dose. Around 17% of all adults in this country are fully vaccinated, which of course in some instances means receiving 2 doses. We are below the global average, but there are still some in government hoping that we could reach that level of around 70% of the population vaccinated by the end of the year. To discuss, we're now joined by legal analyst and public commentator advocate Modidima Manya, as well as political analyst Professor Suzanne Boyson. Thank you both for your time. Let me start with you, advocate. Simply, what are you expecting the President to say tonight?
Well, I expect him naturally to take us to a lower level. Obviously, we are under tremendous pressure as a nation. The economy has been battling, unemployment has increased, and poverty. So I expect, and of course, with the rollout of the vaccination program, I expect him to ease the restrictions.
Professor, do you agree?
Yes, certainly. Definitely looking at lowering to level 2, adjusted level 2, and various aspects to that, ranging from concessions to the hospitality industry to, of course, South Africans like the lessening of restrictions on liquor sales, gatherings that are important, and both in terms of specific health conditions. And we have to remember that we operate in pre-election conditions. So he is also bound to look at different constituencies like churches and traditional leadership in initiation schools. For example, we see that. And in a bigger picture, more abstract picture, we definitely looking at to see how he will go about to balance that right to personal rights, individual rights to decide perhaps not to be vaccinated, but to balance that with a broader national interest and security of the workplace, for example, and specific lessening of restrictions on not just hospitality industry, but business in general, so that the economy can open more generally and that business can take hold again, and we can lessen the rate of loss of jobs. That will be so important in this address of his tonight. So there are big issues at stake.
Well, Professor, talk to me a little bit more about the politics. I mean, it's all meant to be about health concerns and economic concerns. But will the President be keeping in mind that political parties want to campaign? The local government elections are looming. And of course, it may be it'll be politicized when any party flouts regulations and there's a crackdown. So he has to be really careful here.
Indeed. You know, we're looking at the limits probably going up to different outdoors, 200 or 250, which is still very, very small and a far cry from big election rallies. Although apart from those demonstrations of power that we see in the rallies, usually just before, the weekend before the elections, that we'll see nothing of that sort. But otherwise, there will be a lessening of restrictions that will definitely have to apply to political parties. And, you know, in South Africa, generally, there's a sense of disdain for the law, disregard for the law. But when it's as high profile as big election meetings, there will have to be action. And I wouldn't be surprised if he emphasized big aspect of law enforcement and maintenance of usual security measures, safety measures, such as social distancing and sanitizing and so on. But it is going to be a different type of political campaign But South Africans cannot afford to have the election delegitimized by big outbreaks. So there will have to be big measures, safety measures in place.
Advocate, do you agree the speculation is that gatherings could be increased to, say, 100 indoors, 250 outdoors, but that doesn't really make a difference if you want to hold a large rally. So I guess the parties will be forced to be innovative or to take on the police and flout those regulations.
Yes, I think the issue of the numbers for me is irrelevant. I am a bit concerned that for a while now, over 18 months, we have been in this new normal. And we seem to be gravitating towards wanting to go back to the old normal, even in the face of this pandemic. If the president were to increase anything beyond 250, I would be very worried, because we could easily go back to a super spreader situation, especially in the light of the ongoing resistance from among some of our fellow brothers and sisters to vaccinate, because we still have a higher number of resistance of people saying all sorts of things about vaccinations. I think the other side of it is that the government must now bite the bullet and put in measures to protect those of us who are responsible enough to vaccinate against those who are irresponsible and refuse to vaccinate, and impose measures that will punish those that do not vaccinate as opposed to punishing the entire population, including those who are vaccinating. And I think that would be lawful to do so. So the question of whether we have learned, and I think many people are really understanding the concept of social distancing. Of course, the whole rhetoric around political campaign introduces a lot of difficulty, and in fact, already we have seen a lot of defiance. We have seen some political parties continuing to have meetings outside the prescribed maximum of imposed by the restrictions.
So you raise an interesting thing about vaccines. I want to ask you about incentives, but if he does what you say and starts to align with the health minister, who seems to be moving towards restrictions for people who are not vaccinated at events, for example, then won't people look at the previous words of the president? He said it's not going to be mandatory. He's always had this stance that people will have a choice, but if their options are limited, do they?
Well, the president and the government have given us a choice, and we have abused the choice. Now they have to change and make it mandatory, because I think the attitude of the president must not be construed to mean that he meant those who do not want to vaccinate or cooperate with the measures are free to harm those who are prepared to cooperate with the measures. What he was doing, and as you remember, he used the word, it's in your hands, and he was appealing to the nation and to citizens to take responsibility. But we cannot continue. The economy has suffered significantly. There's a high rate of unemployment. We are forever expanding the social security network. Something has to give. And we need to move to a stage of ensuring full compliance with the law. And if it means we must restrict rights, as has happened, by the way, these restrictions have restricted our rights to movements and other rights. And the Constitution itself is very clear that rights can be limited, including in the public interest. And I think it's in the public interest that the government put its foot down. We can't afford to have soldiers on the ground. It's very expensive. As the police are on the ground trying to enforce COVID restrictions, criminals are going on rampage. So the government has to do something. And people who do not want to vaccinate are a risk to others, whether in the workplace, whether in public spaces. So I don't want to understand the president to be saying we have a right to infect each other and not take the medication. Yeah. The vaccine is freely available. You can't even say, I don't have money, so I can't pay.
But Advocate, quickly answer, this is a big legal debate. What can companies do? Of course, there's some people who are in frontline positions in companies, maybe a problem there. But the unvaccinated are saying, why am I a threat to somebody who's protected because they've received the vaccine? Why am I such a big threat?
Well, I don't understand, and I'm fully vaccinated. I've got 2 doses, but I don't understand myself to be immune from vaccination. What I understand is that having been vaccinated, I'm at a lesser risk of hospitalization, which is one of the major burdens that the state has been carrying. So, and by the way, the virus keep on mutating, and we know that. That's why we keep on hearing this type of virus, this type of one. But I think if you look at the workplace, for instance, employers have a legal obligation to create a safe working environment. And you can, because there's no guarantee that if you are vaccinated, you cannot be infected. Those who are vaccinated remain at risk. So the whole idea of having as many people as possible vaccinated is to reduce the risk of infection. So employers and the government have an obligation to protect those of us who have vaccinated. So people have a right not to be subjected to medical treatment, but others also have a right to a safe and healthy working environment.
Professor Boyson, do you agree that the president, who always seems to have emphasized free choice, may change the rhetoric a little bit tonight and start hinting that some limits will be tolerated?
I would certainly hope that he comes across more strongly than he has in recent times, at least where he's been interpreted to have come across, has been absolutely even-handed between, yes, you have a right not to deny or to refuse, but please do. And it is indeed that so much so of the opening of the economy truly depends on this, and opportunities to return to a life roughly normal, attend events, etc. Those truly depend on people being vaccinated. There's overwhelming medical evidence by now, also of the type that recently was released by Discovery Health, that people with vaccination have a far, far reduced chance to be mobilized, to be hospitalized, to be dying if they're hospitalized and have not been vaccinated. That medical evidence is incontrovertible. And I would hope that President Ramaphosa sees his way clear to come across very, very strongly on that.
Yeah.
Because any type of normalcy depends on that, every which way we look at it.
Well, Professor, what do you think is his responsibility for a governmental communication campaign or non-campaign around vaccinations? It's been described as very ineffective.
Yes, indeed. It really, truly has to be stepped up. I think I've seen a few signs in the last few weeks, but it has been stepped up. We see little enclaves here and there, and advocates coming up forward, advocates of vaccination coming forward and making a strong case there. But I would like to see a systematic escalation of that campaign, because there is no two ways about it that people who are vaccinated have got the right to be protected against others. There are breakthrough infections. And it's so easy for the anti-vaxxers to speak about small percentages and their small chances. Of course, those are very small in an overall population of around 60 million. But when we come to those percentages and your chances when you have been infected, then it is so much bigger when you have been vaccinated, to your chances to survive. Hugely different. And I would hope that message comes across very strongly, not just tonight, but indeed in an overall very strong campaign, because the ANC government depends on that. It's a big part of overall trust in government, that it can be seen to be doing things effectively. So far, it has been quite fortunate in being seen that, for example, Gauteng residents, more than over 60%, think that the government has been doing a good job in dealing with COVID, which in some respects may be surprising given the levels of corruption that have been unveiled there. So we would also expect President Ramaphosa to address that, but overall to come across as worthy of the trust of citizens in continuing to run the vaccination campaign as an essential part of handling anti-COVID action.
Advocate, what's your view? And And I guess this is sensitive because some people don't trust government and they don't trust pharma. But if government pushes vaccinations too hard, that may cause some people to be reluctant. Some to get the politicians out the way and let the scientists talk. Just tell me what you think the president should be saying or doing to ensure a better message about vaccines gets out.
Well, a big part of this.
Firstly, let me say that my view is that the message of government on COVID has been effective. I mean, I've been to far-flung rural areas. I've seen people do some social distance, people wear masks, people understand that they are vaccinated. The president, and I must give it to him, objective facts, he has provided good leadership. Bar the issues of the PPE scandals and other things, we have now got used to what we call the family meeting, which is what we will have at 8 o'clock. And the president has been in the forefront. Yes, we have had major challenges, but I think what we have still not spoken about is the responsibility of citizens themselves, because rights go with responsibility. The president and the government cannot walk house to house and pull us out, put us in the street and vaccinate us. We must walk to vaccination sites. As you can see, there's now even walk-through vaccination sites. So I think on this issue, really, to call the government messaging ineffective, in my view, is a bit unfair. But having said that, the question about...
But there is widespread vaccine hesitancy. There is vaccine hesitancy.
There is vaccine hesitancy informed by a number of things. We have had some people and some senior leaders in our society talking about the devil in the vaccine. That is not good. We have had people make all sorts of suggestions that people die. I think the Medical Regulatory Authority just released a report recently to confirm that none of the deaths that they investigated is related to the administration of the vaccine. I think some people have had some side effects, but that have not lasted long. And if you go to a vaccination site, you will be told that there will be some side effects. I've not, for instance, had any side effects except the pain of the needle. I think the point that we must make is that at the end of the day, as people, we are the ones to be affected and infected. We must also take responsibility alongside the efforts of government. So there's of course been some stories about vaccines, but as Professor Boyson has said, a lot of this, there's now incontrovertible medical evidence, and instead of us relying on propaganda and other things, we should rely on what scientists tell us. The government itself and the president are relying on scientists.
Yeah, the facts are there. Well, I'd love to know what you both think about something that's been controversial overseas. Let me start with you, Professor. Do you expect government to announce incentives around vaccinations?
I do think so, and even more than think so, I hope so, because that is a positive, affirmative way to go about to encourage people to do more, to get vaccinated. And one of the things that we've seen being mooted here is access to certain events, sporting events, cultural events perhaps, but overall sporting events would have a huge pull into getting people, even if they are doubtful, but be very strict in controlling access to these events and make it a reward, a positive affirmation and a reward, whether people truly believe in it or not, but that could go a long way. And it will certainly help protect those who have been vaccinated, and it would most definitely help build up those that 60, 70%, even just 60% towards the end of the year, that will give that population immunity. So it is a big way and a positive, affirmative way. I would hope to hear that tonight.
Advocate, do you agree? The US was offering even more money to get vaccinated.
Well, yes, look, there must be incentives. I must feel comfortable that even the government recognizes that I want to be a free person, so I'm vaccinated. Allow me more movement and release the restrictions for me because I'm vaccinated. And I think that's what South Africans are asking for. For people who have to go and look for jobs, it is important that they get vaccinated because they are going to interact with other people. Those who are in the front line, and we know all the health workers have taken the pain of looking after us They were the first to be vaccinated. The teachers in the schools have done the same. And I think, I don't even want to call it an incentive. I think that it's more of an opportunity, a further opportunity for us to be free with the lessening of restrictions subject to us vaccinating and complying with other measures.
All right, Professor, back to you. I was looking at an interesting Gauteng study on the show recently, showing that people have a real problem with service delivery from government, but some real happiness with government's response to COVID-19. However, there's still this ongoing global debate. I mean, it's still being argued, do lockdowns in fact work? Is the economic pain worth it? And of course, the data keeps on changing across different regions. Do you think government's current stance is as rational as it could be, given the information available?
Francis, if we look at lockdowns, the way we are handling it now, government is handling now, it's certainly vastly different from the initial responses early last year, where the clampdowns were much more serious. And by now we know, with certain conditions being maintained, safe social distancing and sanitization, for example, the chances are going to be much less of being infected. But then we also know that it comes with social responsibility, and people go about very often with gay abandon and just ignore all measures. So lockdowns really do work. Moderated ones, we have learned, work as well as the harsh ones that we've had early last year. So I definitely think lockdowns, they work. It's not a generic thing. It is something that stands on specific legs, like containing social interaction when people do come with disregard. And it also asks for enforcement of those basic measures like social distancing. And with those in place, that is the definition of a lockdown. Lockdowns work. They are a continuous reminder to people that we do not live in normal times.
Yeah.
That we need continuous action to maintain and to grow population immunity.
All right, I'm going to ask both of you to stay with us, please, but we will take a quick break on the show, and then we'll continue this discussion with Professor Suzanne Boyson, political analyst, and Advocate Modidima Manya, legal expert, of course, and public commentator. Stay with us.